Mistakes that ruin your patient's ACL rehab. Number one, not hammering extension. You have to get terminal extension before you even think about flexion. Not just terminal extension, but hyperextension that matches the other leg. Don't start working on flexion until you nail extension. Two, spending too much time on gait and squats. That stuff's important, but hit that extension first. Hit the quad strengthening first before you start talking about gait and before you start talking about glute. Number three, spending way too much time on hip strength. Hip flexion strength is important, hip extension strength is important, but make sure that the quad and the knee is totally straight and where you want it before you start talking about hips. Number four, not using electric stim for quad strength. So often, patients coming out of ACL surgery, they can't feel their quad working. Slap some pads on that thing and ramp up that electric stim so that they can really feel their quadricep contracting, and you'll set your patient up for success. And finally, poor dosing and appointment frequency. 2 times a week, 3 times a week, that's not always the answer. If they're lacking extension, you gotta see that patient every single day until they get their extension all the way back. These are the 5 most common mistakes that PTs make that set their ACL rehab back. Take our masterclass.